On today's show, we have Gisele Seguin joining us, the Director of Public Affairs, Communications and Philanthropy at Windsor Regional Hospital. Gisele, welcome to the show.
Hi, Rob. Good to see you.
Thank you. Good to see you. How are you and your family doing during this pandemic?
Well, my husband and I are trying to follow all of the rules and stay in as much as possible. I'm, of course, coming into the hospital. However, we have a schedule where we're really trying to rotate people at home and to try to do all those good social distancing measures as much as possible.
Yeah. How has COVID-19 affected you in fundraising at Windsor Regional Hospital?
Well, it's been very interesting, certainly. As you know, Rob, our community is amazing. And at the beginning, we had so many people coming forward with PPE, masks, gloves, hand sanitizer, all that sort of thing. And that was, very, very much appreciated. We weren't sure what we needed. Now that we've been, we're further into the pandemic, we have a pretty good idea. We have a list of equipment that we need, and the public has been fantastic. So those first couple weeks were very, very busy. And again, we weren't sure what we needed. One thing, for instance, Rob, people at home have been sewing masks. And at first, we weren't sure how much of a use they would be. They've been incredibly important. We've probably had close to 10,000 masks sewn and donated to the hospital. So that's just one example of how generous people have been. Naturally, because of we've had to purchase all kinds of equipment, and we have spent about $3 million on equipment in the last 2 months. So people have also been very generous, making contributions that help us purchase that equipment in our fight against COVID.
Talking about fundraising, how is the hospital funded, and why do you need to fundraise?
It's a great question, because people are always surprised because, of course, we're funded by the Ministry of Health. But what they don't realize is that communities have to make a contribution if you want to have that latest state-of-the-art equipment. That's what the community has to help us with. We're fortunate because Windsor and Essex County is so generous, but that's the about 90% of what our foundation does is actually raise money for specifically for equipment for hospitals, both the Olette and Met campuses.
How has the community responded to Windsor Regional Hospital's needs?
It's been unbelievable, Rob. We've had many donations of cash that can go directly towards purchasing ventilators, glidoscopes, equipment that can be used right now in the fight against COVID, but also great equipment that we will be able to use on an ongoing basis in our ICUs and emergency. So we have a great wish list, and we're always open to talking to donors as well about some of those items and things that we need. Diagnostic equipment we just had a campaign to raise money for a digital mammography, for instance. But unfortunately, with COVID, it's not been able to be put into use just yet, but we're hoping that's coming soon. So always equipment that we need. We had something recently in Canada that came up with something called Giving Tuesday Now. And two of our donors, Beth Yee and Kevin Yu, went to the community and said, we're giving $25,000 each to Windsor Regional Hospital. We will match what everyone else is willing to give. On one day alone, that came to over $100,000. So again, people really rise to the occasion in this community. We have all kinds of equipment needs. We're also willing to discuss some of those needs anytime.
Well, we do have a very giving community. So in case other people do want to contribute, where can they do that? How can they do that?
WRH.on.ca. If someone wants to look at our website, they can certainly call the hospital at 254-5577 anytime, discuss that with someone in the foundation. And Rob, I really want to say that we've had everything from children showing up with their, their piggy bank, to major donors like Kevin and Beth that I mentioned, and everything in between. It all adds up. So no one should feel that that donation isn't going to amount to everything. That's what makes giving in this community so great, is that it's so many people helping in so many ways. So people shouldn't feel that that's not significant. Every gift counts and contributes towards the purchase of that equipment.
Well, and there's been an outpouring from the community, especially now during COVID-19, for all our healthcare workers and offering support and everything. So it's important that we do this now, but also throughout the year.
Absolutely. And one thing, Rob, at the beginning, people really wanted to support our frontline staff. So we were getting a lot of donations of food and other items. We have decided that we're now going to pay that forward. And what we're doing is suggesting to people that the gifts of food and items can go to other community organizations that need it.
That's terrific. Getting back a bit to the hospital, can you advise the community about the emergency department and when you're ill, you really need to come in? Yes.
We did notice right away when the pandemic was called that our numbers in emergency went down, and we knew that people were staying away because they were nervous about coming to the hospital and they could maybe get their care elsewhere. But we also want people to know that if they are needing emergency services, we are here. We've taken the precautions. So, people even with cardiac issues in the province of Ontario, they're finding are staying home, and that's not good. We're just starting up services again. Some diagnostics and elective surgeries have just started this week, so we'll be seeing more of that. But if you need emergency services, please come to either emergency department at the Ouellette campus or the Met campus.
And also visitor protocols. I know that's changed a bit. Can you tell us a bit about that?
It has changed. We are still restricting visitors because we know that we want to stop the spread and limit visitors, but we also know how important that is to people's care, that they're able to see their loved ones. So we are now allowing more visitors in. I suggest people go to the website to see the details or talk to us in advance, but essentially most areas, with the exception of COVID positive patients, can have one visitor, and on a day basis, that visitor could change. So, for instance, one visitor per patient per day, another family member could visit the next day. But I do suggest talking to the department, but we have opened that up. We found when we started last Saturday, of course, there was a pent-up demand, so there were a number of people in line. So they have to be screened, they have to answer some questions, so it might take a little longer than normal to enter the hospital, but visitors restrictions have been adjusted again. So check with us, but we want to make every effort that people can speak to their loved one. We're still providing services through iPads so that people can FaceTime with loved ones when they can't visit. So we're
Great.
happy to continue to accommodate that.
Okay, and just a reminder for anyone that might be interested in donating or helping out, the website?
wrh.on.ca.
Terrific, and we always leave our interviews with looking for some hope. What are you looking forward to when this pandemic is over?
Well, certainly, I think that we want to celebrate our frontline workers, and that's what I'm looking forward. It's an opportunity to really thank our frontline workers for all that they've done, because it's been a privilege to be in this position and see what people are capable of and the work that they've put in. So that's what I'm looking forward to after the pandemic.
Terrific. Well, thanks, Gisele. Thanks for coming on with us. And please, on our behalf, please thank all the healthcare workers there at Windsor Regional Hospital.
Thank you. Thank you to the community too, Rob. Bye-bye.
Thanks. I was Gisele Seguin, Director of Public Affairs, Communications and Philanthropy over at Windsor Regional Hospital.